Hello everyone, and welcome to the YouTube channel for the medical practice Dr. John's Best Health. I am Dr. Chinwe John, and I'm a board certified specialist in the field of physical medicine and rehabilitation. Today, I would like to help you answer the question, is low dose naltrexone, often called LDN, a good treatment option for your particular disease condition? I will start first by answering the question, what is LDN or what is low dose naltrexone? There is a medication which is FDA approved called naltrexone, usually dosed from 50 milligrams a day upwards. Naltrexone was FDA approved for the management of opioid addiction and alcohol dependence. What naltrexone does is it blocks the opioid receptors in the brain and prevents people from getting any form of high or enjoyment from using those substances, so why bother? So it helps someone come off the use of opioids and alcohol. In the 1980s, there was a doctor in New York called Dr. Bihari. And Dr. Bihari, through experimenting, found out that if you take a small dose of this same naltrexone, this means usually 4.5 milligrams and below, and you give it to a person, typically at bedtime, but not exclusively, what it does is block some of the opioid receptors in the brain. And what this does is make the body produce more endorphins, more of your own natural opioids around 2 to 3 a.m. when they are produced. And so it gives you a good effect of having an increased amount of endorphins released in your system, and this lasts up to 24 hours. But apart from increasing the amount of endorphins that your own body produces, low dose naltrexone has other functions, other uses. I'll answer the next question, which will be, well, is low dose naltrexone FDA approved? Why haven't I heard about it? I will tell you that most patients who contact this practice seeking low dose naltrexone found out about low dose naltrexone through their own research. These are people who have suffered typically for years with chronic pain conditions or with autoimmune conditions not getting better. And they do their research, find out about low dose naltrexone, and come seeking a physician willing to prescribe low dose naltrexone and manage the use of it. Low dose naltrexone is not yet FDA approved. Why is this the case? The main reason is for you to have FDA approval for a drug, you need to carry out large clinical studies. Typically, these studies are funded by the drug manufacturer. But because naltrexone itself is already FDA approved, you cannot patent low dose naltrexone. Therefore, there has not been that large study which will allow low dose naltrexone, if other requirements are met, to have FDA approval. This does not mean that there are not numerous studies that have already been conducted on the use of low dose naltrexone. There are many studies that are being carried out even as I speak in very reputable institutions, trying to document the varying ways in which low dose naltrexone helps you to reduce the inflammation in your body. Low dose naltrexone is used worldwide at this point. In a country like Norway, it is said that up to 70% of the general practitioners or primary care doctors prescribe low dose naltrexone to their patients. Apart from helping your body increase the amount of endorphins it produces, low dose naltrexone acts as an anti-inflammatory agent, both at the level of your central nervous system, which is your brain and your spinal cord, and your peripheral nervous system, which is the nerves going down into the rest of your body. How does low dose naltrexone accomplish this? Low dose naltrexone inhibits the white blood cells which help to trigger an inflammatory reaction. Not all inflammation is bad. The white blood cells in our body are there to protect us, but sometimes they overreact and you have overproduction of inflammation, and this leads to varying disease conditions. Or you have conditions like autoimmune diseases where the body attacks its own self, where it sees parts of itself as an intruder, and your white blood cell gets activated and attacks that particular organ. An example would be Hashimoto's thyroiditis, which is an autoimmune condition where your body attacks your own thyroid. Other autoimmune conditions are rheumatoid arthritis, systemic lupus erythematosus, psoriasis, and others. By inhibiting inflammatory reactions in either your central nervous system or peripheral nervous system, low-dose naltrexone is able to help people with conditions such as chronic fatigue, multiple sclerosis, a varying list of autoimmune conditions, and also chronic pain due to complex regional pain syndrome. At this practice, we are able to help patients who have autoimmune conditions and chronic pain by using low-dose naltrexone. Now, does everyone with an autoimmune condition and everyone with chronic pain see improvements after the use of low-dose naltrexone? The answer is no. There is not one treatment for everyone. Each person has to be taken as an individual. But I will share that in totality, the success rate has been quite high using low-dose naltrexone for the management of inflammatory conditions and acute or typically chronic pain conditions. What are some of the side effects that you could have by using low-dose naltrexone? In this practice, what we do is start you off on a low dose of LDN, and we titrate up very gently, monitoring you along the way. And the most common side effects that we see here are vivid dreams, which are temporary, people waking up in the wee hours of the morning when they have that endorphin surge, and if that continues, the way around it is to change the timing. Some patients have brief headache. Some patients have some GI means your stomach, some stomach symptoms, but these all resolve. If a person has continued side effects, the medication is stopped. At this practice, we don't keep people on low-dose naltrexone if it's giving them side effects that last more than a few days. And certainly, if anyone has an allergic reaction, that is a reason to stop low-dose naltrexone right away. Once again, there is no one drug, typically, especially in chronic conditions, that can manage all your symptoms and takes care of everything in totality. Usually, when a person has a disease condition, you have to address many different aspects of the person's health. But certainly, low-dose naltrexone, in my experience, has been a safe way of managing chronic inflammatory conditions and autoimmune disease. This management will be done alongside the management you will do with your rheumatologist and neurologist and other specialists. But it's a good part of your treatment regimen in our experience. I look forward to assisting you, and I hope this video provided some information about low-dose naltrexone. Thank you and stay well.